We have had a robust year here at Authority Health. Our administrative staff returned here to the new center building earlier this year. Not only have we been able to continue our mission to coordinate efforts to improve the population health of the residents of the city of Detroit, Wayne County, and the region by assuring access to care, we were also able to enhance that mission by leaving the four walls of our clinical practice and supporting our community health partners through COVID testing and administration of COVID vaccines. Throughout the summer and into the fall, our community medicine residents and our clinical staff provided COVID vaccine events for the Neighborhood Service Organization, for the Greater Mitchell Church of God in Christ, for the Gospel Against AIDS, for the New Light Recovery Center, and most recently at Hope Academy. As soon as the vaccine was made available for 5 to 11-year-olds, we hosted a vaccine event at the Hope Academy. As recently as last night, we provided the second dose to the young people. Through our efforts, we have been able to provide vaccines to hard-to-reach populations, meeting them where they are at times that are most convenient to them. I'd like to take this time to acknowledge our Chief of Staff, Brandy Lagazinski, and Dr. Carolyn Custer for coordinating those efforts. Additionally, we have been taking a very personal approach to overcoming vaccine hesitancy. Many of you know that Authority Health sponsors the year-long Albert Schweitzer Fellowship. This fellowship mentors young professionals on the path to humanitarian service. One of our Schweitzer Fellows is dedicating her time at the Popoff Family Health Center, spending one-on-one time with our patients as they come in for their medical visits. She talks to them about the importance of receiving vaccines. She listens to their concerns, and she helps them overcome their fears. What we have found is that when she's there providing that one-on-one consultation, the interaction that she provides, vaccine acceptance greatly increases. Now I'd like to turn my attention to our financial performance. We always need to talk about the money. I am pleased to report that we are completing the year 2021 in a strong financial position. In accordance with the generally accepted auditing standards and government auditing standards. Now, you know this was written by my CFO, right? So I'm going to get into a whole lot of this, that, and the other. Yo and Yo, CPA, and business consultants audited the financial statements of Authority Health's governmental and business functions and the major revenue funds for the year, which ended September 2020. Now I'm going to get to the part that I like to say, the simple English. I'm happy to say that for 15 years in a row, the auditors issued Authority Health a unqualified opinion, what we call a clean audit. So hopefully you can hear the applause here in the room, but you can also throw up your reactions. You can put some thumbs up and some applause on the screens there. I would like to credit our Chief Financial Officer, Jeanette Davis, as well as Corliss Beard, our Director of Finance, for assuring good financial management. And right now we are preparing for our 2021 audit. Now, despite another year of working through a pandemic, Authority Health experienced stable growth in our mission-driven service delivery and ended our fiscal year with a fund balance of $1.8 million, which included one-time COVID-related funding. Now, we have several revenue sources for our programming. I'm going to name a few for you. We continue to be the second largest teaching health center in the nation with federal grants for our graduate medical education. We also continue our services to a Medicaid eligible population and health insurance enrollment services with funding from the Michigan Department of Community Health and Human Services, and now they're also providing funds that supports our Child and Adolescent Health Center. We are also very proud that we are providing services to the Detroit Public School District, where we assist them with COVID safety compliance protocols, and this enables them to maintain in-person learning and also assist them in controlling COVID outbreaks. Our medical residents are providing services at the Veterans Hospital, and we contract with health plans to provide re-enrollment services. We also seek grant fundings, and I'm going to talk a little bit more about that. Well, actually a lot more about that in detail a little bit later. And we also receive individual donations that support our programs. Last but not least, our clinical revenue supports our community health centers. Overall, we are in good financial position, and we continue our important mission thanks to the support of our board and the hard work and dedication of our staff. Please thank me and please join me in thanking both. Let me turn my attention now to our clinical services. We started the year with something that we really enjoyed, and that was dedicating the Anne Murray Ice Pediatric Health Center. Now, we named it after Dr. Anne Murray Ice, who is truly a legend, a gem, and an icon in the city of Detroit. A pediatrician who has been working in this area and in this region for many years. We were pleased to be able to dedicate our pediatric practice in her name and in her honor. And we are providing health services for young people on the northwest side of Detroit in that area. This summer, we also dedicated the Hope Family Health Center, which provides child and adolescent health services in the Narden Park area, Detroit's near west side. It's based at the Hope Academy, which is a restorative justice charter school. This health center provides primary pediatric care for children in the school as well as the neighborhoods surrounding the school. Our community health services have received a boost from multiple grants that will support the expansion of our facilities as well as staffing. I'll talk to you about a few of those. We are pleased to have received a grant of $34,300 from the Children's Foundation. This grant will help us to implement a mindful performance therapy at the Hope Family Health Center. Now, this is a CrossFit program that will improve physical health as well as school performance through improved memory, processing speed, and academic achievement. You know, these are the kinds of things that I'm very proud that Authority Health is able to provide. You know, we go beyond just the basic and traditional health services, and we also are able to bring in, through generous grants such as the ones that I just described, those things that actually reach the whole person and also deals with many of the social determinants of health and also just touches the whole person. So thank you to the Children's Foundation. We also believe in the essential role of community health workers in extending primary care in neighborhoods, faith-based organizations, and community centers. We are very pleased that the state of Michigan included $450,000 in the 2021-22 budget to fund a 3-year initiative. Now, this initiative will allow us to include community health workers as part of our clinical team. We are especially grateful for the advocacy that Senator Sylvia Santana provided for her leadership in securing this appropriation. Through this appropriation, we will employ community health workers to provide care coordination, support management of chronic disease, as well as the successful mitigation of COVID-19 health impact. We'll do this for a high-risk urban population. We believe that this initiative will enhance the quality and coordination of care. It will increase access to care for the at-risk communities, and it will improve health outcomes. Another enhancement of our services is from a $40,000 grant that we received from the Blue Cross Blue Shield Foundation of Michigan and the Ethel and James Flynn Foundation for the program Healthcare Bridges for Stable Health Program. This grant will support additional funding for our medication-assisted therapy at Popoff Family Health Center. Now, those of you who know me have heard me say this before. You know I have a passion and a heart for the recovering community. Throughout my public health career, I have seen the devastation that addiction to alcohol and other drugs cause. Sometimes success comes in individual stories. And through our medication-assisted program at Popoff Family Health Center, we now have individuals who have committed to working through their substance abuse disorder by having regular visits with our physician, regular visits with the behavioral health therapist, and continuing with medication-assisted therapy. They are no longer trapped in their addiction, and they are on a path to developing a healthier and productive life. The grant that was provided through the Blue Cross Foundation will provide more staffing to grow this program and serve many more people. We have partnered with the Mental Health Court, the Veterans Court, and the Drug Court to identify more individuals who can benefit from our medication-assisted therapy. Authority Health also received a $450,000 grant from the Total Health Foundation. This grant will help us to expand the Popoff Family Health Center on Detroit's east side. We will be developing and creating and building a demonstration kitchen. Now, one of the other things that we do here at Authority Health is we try not to have fragmented programming. We, for many years, have been involved in what's called the Fresh RX, where our physicians write prescriptions for fresh fruits and vegetables when we identify patients that have chronic conditions and also have a BMI of 30 or larger. And in addition to that, in addition to writing the scripts, we partner with farmers markets so they can get access to fresh fruits and vegetables. Now with this additional grant from the Total Healthcare Foundation, now we're able to build this demonstration kitchen where we're able to actually teach how to prepare foods in a healthy way. So it really builds on to the program that we have been providing in the past. In addition to the demonstration kitchen, this grant will also allow us to build a group therapy room as well as an additional individual therapy room. Also this year, we have been pleased to partner with Wayne County in a major 3-year grant to address vaccine hesitancy in 9 communities in out Wayne County. Our role is to work with the Wayne County Health Department to provide administrative support and convening support. We would like to congratulate Wayne County for being awarded the grant to do this important work, and we thank you for allowing us to partner with you. Please let's stop and acknowledge that. And while we're acknowledging the several granting agencies that are supporting our work, we should also thank the Metro Health Foundation, which has generously supported the Albert Schweitzer Foundation, the Albert Schweitzer Fellowship, and continued to do so this year. Also, we are grateful to Wayne State University School of Social Work for a $5,000 donation to the Schweitzer Fellowship. Please also thank them as well. I have to stop and say, that's the beauty of having not only the virtual environment, but also having some human beings in the house. Last year, I was totally virtual talking to myself in the kitchen, so I appreciate having even a small audience here. Thank you. Our graduate medical education, I'm going to turn my attention to that for a while. Our graduate medical education teaching health center residency program continues to play a central role in our mission. This summer, we graduated 21 residents, most of whom established their practice in medically underserved areas. We are excited and hopeful that the year will end with the passage of the Build Back Better. Now, I practice that a lot, right? The Build Back Better legislation, which among many other good things will result in the long-term funding of the Teaching Health Center program. Now, Congress reauthorized funding for the Teaching Health Center for 3 years, last year. Prior to that, the authorization was only for 2 years. So we're thankful for the 3-year reauthorization. This opened the door to a proposed appropriation for 10 years, which is included in the Build Back Better legislation, which is currently under consideration by the U.S. Senate. This is something that we all should keep our eyes on. Now, after the murder of Mr. George Floyd and many others whose names should not be forgotten, Authority Health knew that we needed to do more than just make statements about anti-racism. Our residents really pushed us and said, we need to do more, we want to do more. And we did do more. In partnership with New Detroit, we developed a 3-year curriculum on anti-racism and understanding implicit bias. This year marked the completion of the first full year of the anti-racism and social justice training that we offered our residents. And I'm going to stop so that you can throw up some reactions and generate some applause. Provided in partnership with New Detroit, these monthly programs inform and engage our residents in a way that is helping to shape their character and practice style as physicians. The learning objectives for these 7 sessions were achieved, but most notably were the astute and often sensitive questions that were raised by our residents as they worked through implicit bias and other aspects of the training. In turn, the program was rated highly by our residents, who report that their skills and comfort level in communicating about race was improved. The residents view the program as improving their clinical skills in providing care for people of different race and ethnicity. Now, let me just stop and say a little bit more about this, because this is extremely important. This is a legacy for Authority Health. This is a 3-year curriculum. It's not something that's voluntary. It is a mandatory part of the residency. Physicians change people's lives. They touch people's lives in a very important way. And for our residents to recognize, and for the staff here at Authority Health to recognize that we needed to include this kind of training, even before bias training was mandated by the state, Authority Health had already put this 3-year training into place. We are going to be sending physicians out that are not only clinically well trained, but also those who have been well trained around anti-racism and implicit bias. I would really like to stop here and acknowledge the efforts of Dr. Ernie Yoder, Ms. Angela Cole, and the GME staff for their exceptional leadership. Now, we are also very pleased that Dr. Ali Trippi, she was the first Authority Health resident to join the Authority Health staff as an attending physician. She was honored by Black Family Development for her work in providing pediatric services for the agency's clients. Dr. Trippi, who works at both our ICE Pediatric Health Center and our Hope Family Health Center, as well as in our community medicine program, she received the Integrated Health Life Changer Award from Black Family Development. Dr. Trippi's enthusiasm for her work serves as a positive example for the residents that she works with. We here at Authority Health recognize that she is exceptional, and we are so pleased that others recognize that she is exceptional. Please join me in congratulating our very own Dr. Ali Trippi. Now, I'd like to just turn my attention to our Motion Coalition and our co-chair, Ms. Diane Valade. It is with mixed feelings that I learned that Diane Valade has decided to step down as our co-chair of the Motion Coalition after serving for many years. Diane has been involved with the coalition almost since its inception. Her leadership, together with co-chair Dr. William Dietz, has stabilized and strengthened the coalition into the region's advocate for public policy around childhood obesity. I want to thank the members of the coalition, particularly the steering committee, which has been committed to designing informative quarterly programs and the annual summit. And of course, we want to thank Diane Valade and to wish her well in her continued work for the Henry Ford Health System. Thank you, Diane Valade. Now my final thoughts. Our strong performance in 2021 doesn't just happen by chance. It comes from good programmatic decisions by our servant leaders and commitment from all staff to overcome the obstacles created by the pandemic and to identify opportunities for growth. We are very fortunate to have a strong, supportive board of directors. We are grateful for our commitment and encouragement. I'd like to take this opportunity to offer my personal thanks for the opportunity to lead such an outstanding organization. Our success comes in part through our partnership with other committed health and human service agencies that have also risen to the challenge of promoting community health in this environment. Today's celebration is dedicated to honoring our partners that have provided extraordinary support for our mission. We honor you through the Best of the HealthNet Award.